Why does wound dehiscence restrict your mobility? Imagine trying to move freely after surgery, only to feel a sudden pull or pain where your wound is. That's what happens when wound dehiscence occurs. It might sound complicated, but it's really about your wound opening up again after it was supposed to be closed. This can happen for many reasons, like too much strain, infection, or poor healing. When the wound reopens, it causes a lot of problems that make moving around difficult. The main reason your movement gets limited is because the wound is no longer stable. When the edges of the wound separate, the tissue that was healing is disrupted. This makes the area tender and painful. Moving, especially stretching or putting pressure on the wound, can cause the edges to pull apart even more. That increases pain and makes you feel unsure about moving. Since the wound is not fully healed, there's a higher chance of tearing again. This can lead to more swelling, redness, and even infection. Infection can make the area feel warm, sore, and swollen, which adds to the discomfort. Because of this, patients often feel cautious or avoid moving too much to prevent making things worse. Wound dehiscence also causes more drainage or fluid to come out of the wound. This can be uncomfortable and sometimes causes weakness or fatigue because your body is busy healing and fighting infection. When you are in pain or worried about hurting the wound, you tend to stay still. This lack of movement can lead to muscle weakness and stiffness over time. Doctors usually recommend gentle, low-impact activities to keep your circulation going without risking the wound opening further. Things like sitting in a chair, doing light stretches, or guided physical therapy are common options. These help your body stay active and support healing without putting too much strain on the wound. In the end, wound dehiscence limits your ability to move because the wound is not securely closed. Pain, risk of infection, swelling, and tissue damage all play a part. Protecting the wound by limiting movement helps it heal properly and prevents further complications. It can be frustrating, but following your healthcare provider's advice is the best way to recover safely.